Dr. Monica Gandhi is joining me today. She is an infectious diseases and HIV doctor at the University of California, San Francisco. Dr. Gandhi, thank you so much for joining me today.
Thank you.
President Biden is reportedly announcing some type of vaccine mandate for all federal employees on Thursday. First and foremost, I want to get your thoughts on that. And do you think these federal mandates might have an impact on other companies or other private sector positions where employers might say, hey, you have to get the vaccine or you can't come back to work?
Yes. So by President Biden saying that federal employees need to be vaccinated, and it's not, I think there's going to be a testing out option if you don't get vaccination, which is what is happening here in California, that we required state employees to be vaccinated, but if you don't, you have to test regularly. I think you are seeing the dialogue and the conversation change more towards vaccine requirements, vaccine mandates. Why? Because we thought we'd be at a different place in this country. People didn't take the vaccine, and there is precedent for this in American history. There was a 1905 Supreme Court ruling that actually it's legal and ethical to require vaccinations in the context of a highly safe and effective vaccine for the world to sort of go back to normal. And that was in the case of smallpox vaccination. And so, yes, I think the dialogue is changing, and by President Biden doing that, he will encourage employers to mandate vaccinations or require at least for their employees to come back. And actually, the Apple, a tech company, just said this today, that employers have to be vaccinated before coming back.
How significant, or I guess how effective, are the antibodies for someone who had COVID-19 compared to the COVID-19 vaccine? And then also, to extend that a little bit, how protected is someone who had COVID-19 already compared to the Delta variant?
Well, these are great questions, and I don't think we actually know complete answers to this, but I will say that natural immunity, does provide protection. Actually, two forms of protection. There's you mentioned antibodies; those come from B cells, but there's also T cell immunity, and there have been some nice studies from La Jolla Immunology Institute and here at UCSF that people who have had natural infection still have strong T cell immunity against the variants. And they've studied all the variants but Delta, because these studies were up to the time of Delta. However, what a vaccine will do after natural infection is, even though your T cells may be strong, it will boost your antibody response, because B cells produce antibodies, and those antibodies wane with time. That's natural. That's not a glitch. That's just part of our immune system. They will wane with time. And what a vaccine will do is it will regulate your antibodies. You will create more antibodies, and especially if a virus is circulating, that can really keep you more safe, even from mild infections. So it is not totally clear. I will tell you that France and Spain and Germany are requiring one dose, or asking for one dose of a vaccine after natural infection. The CDC has said 2 doses after natural infection. I think the natural immunity is still fundamentally a debate and a concept that we have to keep on discussing in this country about what is required. In terms of the need for a variant specific vaccine, I think some very heartening data came out recently from Oregon Health Sciences University, which is that you produce memory B cells from the vaccines, and then if they see a variant and they actually put their memory B cells in test tubes with variants, those memory B cells will produce antibodies that are directed against those variants, because they are the blueprint, and then they're going to adapt their antibodies. So I don't know if we're going to need specific variant specific vaccines in the future if our memory B cells are so adaptable.
So if people don't get vaccinated, or if people don't, aren't safe, aren't masking up, aren't taking the right steps, do you think we could have another lockdown like we saw in the early days of the pandemic?
I think that lockdowns at this point are only going to be linked to hospitalizations. The reason that essentially lockdowns occurred was that hospital capacity was truly threatened. And there were places in this country who were overrun in terms of the hospitals. And what vaccination has done is that there are cases of, again, mild breakthroughs. There's even cases where I don't even think it's a case because people are swabbing people's noses. And if they don't do a PCR test with what's called a cycle threshold value and tell you if you have a low viral load in there, you're still going to be called a case, but maybe you just fought the virus in your nose as a vaccinated person and you brought down the viral load. That's a vaccine success. That's why cases are becoming noisy. However, a lockdown will likely only be indicated if hospital capacity is threatened. So unfortunately, it's happening in some states in our country. Really painfully, Arkansas is a very dramatic example of this because they have such low rate of vaccinations. But I don't see states with higher rates of vaccination, even where the cases are going up, imposing lockdowns on a society which are also associated with health effects unless hospital capacity is threatened.
At the end of the day, how do you encourage people to get vaccinated?
I think there used to be, we were talking about 5 ways, which President Biden was talking about. And one was getting the FDA approval on the vaccines, which needs to happen yesterday because having an emergency use authorization can really deter some people when they have to sign a consent form for a vaccine. Number 2 was those getting it into pharmacies, getting it into doctors' offices, getting the one-on-one conversations, mobile vans, mobile sites at your workplace site, and also giving people free transportation and free childcare and incentives. But you will see what we just talked about is that a lot of that was done, including community-based messaging to racial ethnic minority communities. That is being done, that still needs to be worked on. But again, what we just talked about, you are seeing this move towards vaccine requirements and vaccine passports. And what are passports? You can't go into this concert unless you show me that you have a vaccine. You can't come into my restaurant without that. And you will see, and this is happening, it's been literally happening over the last 2 weeks, the change in our country's dialogue about moving away from whatever we could do to incentivize to now vaccine passports and requirements. And I think that's what it's going to take.
Earlier, we talked a little bit about the antibodies associated with getting the COVID-19 infection. And when we talk about the vaccine passport, obviously you need the vaccine to get it. So what happens to the people who had COVID-19 and therefore have the antibodies they believe that are protecting them and don't get the vaccine? Should they go out and get vaccinated in order to get that vaccine passport?
Okay, that's a very good question. So I will tell you that what they have done in Israel, Germany, France is that you can show when you go for your passport or when you go somewhere, you can actually show that you've had natural infection or you can show that you've had the vaccine. And if we're going to talk about vaccine passports, I agree with you that I think we likely do need to have that dialogue, and the CDC needs to have that dialogue about what does it take to show that you've had a recent infection. Is it antibodies? Is it which can wane with time? Is it documentation of the infection? Is it the doctor's note that you were infected? So I think that's a very good question because it's going to come up if we use passports and mandates. This is relevant for both passports and mandates. Is how protective is natural immunity? Do you need 1 dose? Do you need 2 doses? And that is a fundamental conversation that we probably need to firmly have before mandates are put into place.
I'd love to have you back on to talk more about this as we get more developments and information about this. So thank you so much for joining me today.
Thank you very much. Thanks.